continue our series now, we're going to talk about managing chronic pain. So I've discussed with you that I have SLE lupus, and I also have had breast cancer. I'm a breast cancer survivor, but it's been about 4 years. I've spent most of my life being an athlete, not used to being sick and laying around and not moving. However, the arthritis and the chronic pain and the sitting around, it does tend to make things worse. And then I find that when I walk, it hurts me the most. So I have to work with all three parts of my spine, my cervical spine, my thoracic spine, and my lumbar spine, and I have to make sure that my hip flexors are flexible and then strong. In addition to that, we have something called fascia. And the way they describe it to us is if you were to peel an orange, the orange peel comes off and then there's that white stuff, that's fascia. And as that becomes knotted up, which could also be scar tissue, it's very painful, and that scar tissue needs to be broken up to facilitate movement. There's different ways you can do it. I'm sure you've seen those guns that can pound you. There is trigger point therapy. Dry needle therapy is very, very effective. They put the needle with no medicine actually into your trigger point to release the pain. But tight fascia can also be it's underneath your skin and close to your nerves and all different places. So depending on where it is, depends on how bad it hurts. So I'm going to offer you some alternative solutions to break up that tight fascia and also trigger point methods. So these are called Franklin balls, and they're soft, they're pliable, and they're wonderful to facilitate movement in hard places like in your shoulder blades, right in between your shoulder blades. I usually start with our feet. So you would just put this on your foot and smash it and try to roll it back and forth. If you feel tenderness in there, you're going to go from your toe box all the way down to your heel. That's your plantar tendon. If your plantar tendon is really tight, it usually means you have tight hamstrings. So after you do that, you might get 2 of these and roll down your shoulder blades. Then we're going to go to a harder ball. You can use, this is an avocado ball is what we call it, but you can also use like a lacrosse ball or a tennis ball. It's harder, so this is not as forgiving. You're going to start moving through that plantar tendon up and down your feet. And then we might do some gentle stretching in our hamstrings and our calf muscles. So I'm going to show you how we would do that. So I'm going to put my feet up here on this foot bar, and I'm going to grab this bar and I'm going to pull myself down, letting my head be heavy. This is a beautiful hamstring stretch down both of my hamstrings. And as I bring my hands over here to the right, shifting my weight and turning, I'm bringing that stretch all the way down into my low back. Oh, it feels so good. All the way down. This is your quadratus lumborum, down into this low back. It gets so tight right there. So now, I brought some other accessory tools to show you how you might roll out your fascia. This is a foam roller. This is probably the most common known for fascia release. You would put this on your floor, lift up your bottom, and you're going to roll all the way down that spine, all the way up in those shoulder blades, all the way down. You have to be careful when you get below your ribs right there. But if you stay to the left, you can get into that quadratus lumborum right there. It's usually pretty tender for everybody. Rolling back and forth, up and down. You can move your arms up and down. Now, if you're post-surgery, you have to be careful. You could keep your hands here. And you can also roll on your hamstrings. So that feels sort of nice. Rolling this way. If it's real lumpy fascia, you can feel it actually with your hands. You can do both sides. Rolling here. And then this hip flexor is very often overlooked, the rectus femoris. So if I'm going to roll my rectus femoris, I'm actually going to put my tummy on the roller. And I'm just going to shift my body weight as I military crawl And I'm gonna bring, remember your rectus femoris, the hip flexor in the middle. It goes all the way over your hip, down your quad, all the way down to your knee, to your patella. So you wanna roll that out. If that's super tight, you might do this for a while, breathing through it, breaking it up. And they also make smaller rollers that have a different firmness. You can choose your firmness. So this one's smooth. It's firm but not so firm. And then these are smaller with texture on it, which would make it a deeper roll. And then this is sort of halfway in between. So you can do these on your shoulders as well and on your rectus femoris. The other thing is a lot of times people's knees hurt from the outside. We have a hip flexor on the outside, our TFL, and also our IT band. So you want to make sure that you're rolling out the outside of that leg into the TFL, all the way up into your hip, all the way down to the knee on the outside. Oh, it's so uncomfortable. Now, I'm going to share a new thing with you, and it's called Microlight cold laser therapy. So I'm a big proponent of massage therapy. I love massage therapy, and now that we have COVID, it's more and more difficult to find it. So I had a massage therapist come to my house, and she worked on me, and as she was working on my neck, she had the laser on my back or on my feet, and as she was working manually on my back or my feet, then she would have the laser on my neck. All of my pain went away after 3 treatments. So if the stretching and the mobilization with the fascia release and the trigger point release with the different accessories and tools doesn't work for you, or if it's too painful, it comes in a little kit like this. I have it upside down. It comes in a little kit like this, and it's actually smaller than your cell phone. It's so easy to use. I'm officially certified now. I'm an OSHA laser safety officer. You don't have to take the test to use this, but I did. And it's so easy to use, even a child could do it. There's 4 buttons, one turns it on, and then you cycle up. It goes up to 18 cycles, and that 18 cycles is about 10 minutes. And then after you get up to 18, you hit start, and that's it. So these are the probes. So this probe, I'm gonna silence the beeper so you can hear me. This probe has 3 lasers that come out. It's FDA approved. It's often used in veterinarian clinics for animals. It's been used in Europe for over 25 years, and there's been clinical studies here. It's safe. The only thing that you cannot do is shine it on your eyeballs or use it on a live pregnancy. But for me, I use it on my neck, and I can actually leave it on my tight traps right here or on my neck. I can leave it there as long as I want. I can just keep doing the cycles. And while I'm treating my neck, if I'm reading a book or laying in bed or watching TV, I can also have a second probe. The cool thing about this probe is it goes deeper. So this probe, it has 2 holes for the probes, and this probe I can put up here. We have a trigger point on my head, and right above your ear. It's called your temporalis, and this trigger point will actually help release my my sternum. After I had my mastectomy, I got something called sternomastoid syndrome. It was very difficult for me to turn my head and lift my arms up and turn my head to the right. And so with the massage therapy, it was wonderful, and then the laser therapy really, it knocked it out. You can also, if I have this laser wherever you want to have it, you could put it on your hip, you could put it on your knee, you could put it on your feet, whatever. I can take this probe and I can put it on my hands, on my fingers, on my arthritis. You can put it on your sinuses. They're finding skin treatments for it. One of the wonderful things that I think is great, not only does it release tight fascia without pain, so if I were going to put this on my IT band, for example, I would put it actually right on my skin. You can't feel it. It feels like nothing. And so it's very painful to break up that tight fascia. and it feels like nothing, it just disappears. So the dry needle therapy, massage therapy, the tools that I'm showing you, the foam rolling and the balls and the accessories, they're all options. And then a Microlight laser, I'm gonna put down in the post, you can put in a zip code to see if you can get a Microlight laser treatment near you, or you can purchase one for yourself. I bought one for myself. I wanna be able to use it whenever. There's different treatments, but one of the wonderful things is it will knock out a migraine headache in 6 minutes with no medicine. It's great for fibromyalgia, which is pretty much, it's a difficult diagnosis to use. And then arthritis, what else is it good for? Any kind of pain, joint pain that you're having. It helps heal wounds. So if you do have, after your surgery, after you have the double mastectomy, if you have trouble healing, it will actually heal the wound in a faster period of time. You can accelerate it with, you can put CBD oil on it, the laser will penetrate the CBD oil, which will take the pain away. So maybe you wouldn't even have to take a painkiller. That's a game changer. So this has been a very, very effective, incredible tool for me. It's the Microlight, it's ML830 technology, and the science is real. You can research it, but it has given me incredible pain relief, and I wanted to share that with you today. So these are my tips for you to help live a pain-free life. I also want to put up my website and my email, my contact information. If you have any questions of how you can find these treatments or find Pilates in your area, I'm happy to help you try to do that. And I wish you a very successful treatment and journey. Take good care of yourself.